There was going to be a slide over you skipping that. Wow, one of the great joys I have representing the U.S. Pavilion is gatherings. It's really been incredible what the UAE has accomplished in the last 4 months, and with 2 months to go, we've had about 750,000 people through the pavilion. We've had about 4,000 business people, and so post-COVID, it's been really an incredible opportunity to really bring everybody together. So the whole concept of the expo, bringing 192 countries together, has kind of far exceeded my expectations. I'm Bob Clark, and I'm the Commissioner General of the United States Pavilion, and I'm very pleased to welcome you all here today for the World Cancer Day event. Thank you so much to the Emirates Oncology Society, the Emirates Medical Association for organizing today's event. Their dedicated work in spreading cancer awareness and their commitment to the complex care of cancer patients is vital and important. Sadly, cancer is a challenge that impacts too many patients, families, and friends around the world each year. I don't know of anyone who doesn't have a story. I myself lost one of my close friends in the last 2 weeks at MD Anderson, and he fought a tough battle, and he had great care there. But the overwhelming kind of impact that cancer has to all of our families and all of our friends. In my business, I have thousands of employees. I know that every one of my employees is facing some challenge today in their family directly. And I know everybody in this room is living the whole dream of finding cures and innovations. And so it's very inspirational that you're here today. The theme of Expo, as I said earlier, is connecting minds and creating the future. Bring together is an amazing experience. A global collaboration is exactly what needs to happen to continue the research doctors, advocates, and others are bringing about the new therapies, innovations, and technologies to offer patients the highest standards of cancer care, save lives, and make lives better. I'd like to take a moment to recognize all of the survivors and advocates here today. Let's take a round of applause, please. Without your courage, we just couldn't go on, so I greatly appreciate it. We gather in the community to do our part to spread cancer awareness and try to beat a Guinness Book of World Records today, such as today, creating a unique platform to share common experience and facilitate international collaboration. So that should be some fun included too. I'm honored to be included today. I appreciate you doing this event at the USA Pavilion, and I wish you all the best. Thank you for coming here today.
مرحبا، أنا ريكاردو كرم. مرض السرطان هو موضوع بيعنيه الكثير. مثل ملايين من الناس هذا المرض دخل إلى بيتي، عشت معه، وبغض النظر عن الألم العميق أحدث تغيير جذري بحياتي. صحيح أنه كل مخاوفنا وقلقنا وهواجسنا حقيقية، لكن المريض بينظر لنا مثل الشمس اللي فوق الغيوم. أنا بتفهم الألم كتير منيح، ولكن السر بيكمن بعدم تركه يقهرنا ويغلبنا. من دون دعم وحب ممكن نفقد مرضى السرطان. السرطان بيقدر يدمر حياة عائلات كتيرة. لذلك جمعية الإمارات للأورام EOS وأنا مدعيكم نتكاتف سوا ونساعد بعضنا البعض من أجل إحداث فرق بحياة الملايين من الناس. اليوم وقت بتطلع قال ينتصروا على السرطان بشوف وجوه قوية انتصرت على الصعاب برأس عالي وكرامة ملفتة، من دون شعر بشعر قصير أو مستعار، بقبعة أو بوشاح. عيون هالأبطال بتشع شجاعة لا متناهية وحب حقيقي. اليوم هو اليوم العالمي بمرضى السرطان. لكل بطل وبطلة عم بيحاربوا، تذكر دايما إنك وبالأمل وبالحب فيك تقاوم. وبإمكانك إنك تهزم المرض. تذكر إنه الحياة حلوة، وأهم شيء تذكر إنه التوعية هي الأساس. الحملة العالمية لزيادة الوعي بالاكتشاف المبكر للسرطان رح تنطلق ب 4 فبراير 2022 بإكسبو 2020، ورح نكون شاهدين عليها سوا. كونوا معنا.
Hello, everybody. I'm going to try to come close to the microphone so you'd eventually hear me much better than Your Excellency. It's really a great pleasure and an honor to be with all of you today on the World Cancer Day to address one of the most challenging issues of our era and the reason behind so many losses. It's true, but also so many stories of strength, resilience, resourcefulness, and drive to innovate in medical research and treatments. We all have a cancer story to share, whether we lived it in our flesh or accompanied a loved one with this journey. Most every family around the world has crossed paths with the crab. In 2020 alone, more than 18 million people worldwide were diagnosed with a form of cancer. 18 million people. That's equal, even greater than the population of so many countries. Like I said in my opening message, life is all about putting one foot in front of the other. That's what I see when I look at cancer survivors. They are beautiful and strong faces who beat the odds, chin up, head held high. With their cropped hair, wig, hat, or scarf, their eyes radiate with an unbelievable courage and with much love. Today is the World Cancer Day. To all warriors out there watching us now, always remember that with love and faith, you will beat cancer, and we all love you. Today we have a wonderful audience, and we're also joined virtually by so many more. Joining me today to discuss this growing global burden and the importance of prevention in combating one of our era's greatest public health challenges is an all-star panel of medical and pharmaceutical experts. Allow me to welcome Professor Humaydi Shamsi, a mover and shaker, and the president of the Emirates Oncology Society. Please, thank you. Professor Solange Peters, president of European Society for Medical Oncology. Dr. Robert Wolf, professor of medicine in the Department of Medical Oncology at MD Anderson Cancer Center. Unfortunately, he was tested positive, so he'll be joining us virtually as well. Can we see him? Hello? Dr. Rana Haji, Director of Program Management at the World Health Organization. Mr. Ashraf Malak, Associate Vice President and Managing Director of MSD GCC. And last but not least, Mary Khamasmi, Head of Public Affairs, Weber Shandwick, Minat Abu Dhabi, and a remarkable cancer survivor. Well, thank you all for joining me. And before we dive in, Let's start with the basics and get to know the quote-unquote enemy. Dr. Shamsi, what would be the simplest way to define cancer to a person who doesn't work in health and hasn't had to hear a proper explanation coming from a medical expert?
So thank you, first of all, for leading this, and we're very proud to have everybody here. I would like also to thank MSD for their support for this event. This is not only an event for an activity, we're trying to increase the awareness by making everybody think about cancer and also act on cancer. And there's no better day than World Cancer Day, February 4th, and also no better place than Expo 2020 here in UAE, trying to increase the awareness about cancer. So I always tell lay people about cancer when I try to define it as they are abnormal cells in the body. They start a revolution and the body is not able to control them. And then they start spreading in critical organs like the brain, like the liver, and eventually they can cause death. Also, I always tell the public that, cancer is a preventable disease, and also it can be treated and can be cured. So there's no need to be afraid of talking about cancer or also getting checked about cancer, because cancer nowadays is much controlled than 20 years ago.
Okay, so no need to be afraid from cancer.
Not at all.
Cancer today is treatable. Now that we have a clear definition, let's go back to the number. The numbers are not only high, but they're also getting higher by the year, not sparing anyone. No difference between men and women, young and old, white or black. Cancer can tackle anybody. Professor Peters, what is the reason behind those increasing rates?
Well, to complete the wonderful definition of the revolution given by my colleague, it's important to keep in mind that cancer is a genetic disease, meaning that the starting point of the revolution is a gene which has been damaged. Of course, this damage can happen to everyone, to anyone, just by mistake, by damage, by bad luck, and there is a high component of bad luck in every cancer case. However, you can try at least to minimize the damage, meaning that the probability of having cancer can be reduced by protecting a little bit your genes. What does it mean? It means to follow the advices about how to eat. It means about being active. It means about non-smoking policies. It means lots of things about daily life. So you ask me, why does the cancer rate increase? Because all of these principles of the healthy life are potentially less and less followed by obligation sometimes, because eating well cannot be offered to everyone, but also sometimes by choice, because more and more people around the world do smoke, for example. So there are controllable parameters. There's one we cannot control, and it might be the most important component of the increase, and it's a good one. It's aging. We live longer and longer in each population around the world, which is desirable. But thinking about bad luck and probability of getting a damage in a gene over time, the probability is way higher if you live 80 years than 40, right? So important, some prevention to be really promoted, because cancer increases because of smoking, pollution, bad habits, but some things which is good, which is knowing that we are getting older, we need to be better in treating cancer in the future. And you know about numbers, your 18 millions is supposed to become 30 millions by 2040.
30 millions.
30.
Inshallah. Mary, we have defined cancer from a medical perspective, from a medical point of view. You have witnessed cancer differently. You lived with cancer. It lived within you. There was a certain coexistence, a certain osmosis between both of you, and you've defeated cancer. How do you define it from your own point of view? What is cancer to you?
Nothing. I did to him, not to me. I have a motto. This is my life. my term, not cancer, not others will change it. So what I did when I received the news, I'm a very pragmatic person, so I put my agenda, my life, and decide how I will continue. Went into my treatment, never take a day off from my work, never a sick leave, and continue and live the day, the moment. It's not about, it's the disease. Every disease exists in the world. This is another disease. It just stay with you for longer time, and you always have to keep it in your back mind. I defeated it twice before in my breast and a brain, and now I'm going to the third fight, and I will beat it again. It could kill me someday, fine, but it will not kill who I am. It's about the quality of life. It's about how I will enjoy every second that it's my time go. As long as I'm still here, my time is my term. I decide how I will live it.
Your vision about life. You know, by putting your objectives and by trying to envision the future and by trying to think about tomorrow, there are definitely priorities and there were things for you wanted to do and maybe you never thought about doing before. What was the major objective, the main one you have set and you wanted to do it and to reach it and to attain it before anything else?
Would you rephrase? Because for me, it's what matters for me is to continue my life the way I like it. I chose my life, right? I tailor it and I live it and I'm happy with it. So I kept it. I want to keep moving to the last second. So if I die, I will die with the grace and dignity. Otherwise, I'm not going to get any less. I will not accept less. And I will do that every day with my brain now, my tumor, 3 tumors growing in my brain. I do my gym every day. I go to my work every day and lead my team. And I collaborate and meet people and sit with others. And I'm happy. And I'm okay and accept whatever happening. And I will fight. I will not let anything force me to do things I don't want to do. I will do it my way.
Thank you. Dr. Robert Wolf, we go back to you whenever we mention MD Anderson. The first thing we think of is cancer. The journey of cancer has been so long, so complex, so complicated, many upheavals, many objectives attained. It's a tough mission to be an oncologist and to treat patients who have cancer and to work in an environment where cancer is predominant. We have listened to different definitions of cancer. How do you define cancer and the journey of cancer across all those years? Where is it today and where is it going to lead us tomorrow?
Yeah, that's a great question. And I must say that I use the term journey quite a bit with my patients because whether you're a survivor or you're in ongoing treatment, cancer is a journey. You're never alone on that journey. Virtually everybody I care for is on that journey with family or friends, people who love them and want to support them. And it's very gratifying to see people come together around an individual they love and care for to help them on this journey. And obviously, that journey can be quite difficult with toxicities from treatment, pain, other issues of debility, etc. But it can be also a very rewarding experience. It can really demonstrate to people how strong they are. I think most patients are stronger than they realize in terms of facing the challenges that confront them. Now, in terms of being someone who gives cancer therapies, I must say, and I think Professor Peters will also echo this, we are in an amazing time in the revolution of the science of oncology. And we are bringing more and more tools to bear on the problem of cancer. At the high-tech end, we are doing things with surgery that is less invasive, using robots, incisions, allow for recovery from surgeries that is much faster and less morbid than in years past. Our radiation techniques and our energy to deliver radiation is changing. Treatments are more precise and providing us with high efficacy and less toxicity. And we now recognize that we can be more precise with our systemic treatments, our drug therapies. We have targeted drugs that are attacking specific gene mutations. As Professor Peters has pointed out, in her field of lung cancer, there's increasing number of drugs and treatment options available to patients. We are looking increasingly at the particular genomic profile of individual tumors so we can better identify drugs that will work and avoid drugs that won't work and just add to toxicity. And lastly, the incredible miracle of immunotherapy is just beginning. And we are going to see increasing understanding of the ability to use our own immune systems to attack the beast within us and do this with less toxicity and greater cure rates. This is true with drugs, cellular therapies, etc. But I think getting back to the whole idea of prevention, we are starting to recognize that immunotherapy actually works best in an environment that is conducive within the person themselves. So some of the things that Professor Peters talked about, healthy diets, you actually have a better immune system depending on the food you eat, or a worse immune system, what we call the microbiome. The food we take in impacts our body's ability to surveil for cancer cells and abnormal cells and get rid of them. Exercise, for reasons we are still understanding, is very vital to a robust and healthy immune system. And if we're going to have immunotherapies work, having a host environment that allows for unleashing the immune system in a way that can better eradicate cancer is going to be critical. And so I think we have amazing opportunities. We recognize that healthy lifestyle is critical to prevent cancer, also keep somebody strong to endure the toxicities if they develop cancer. Our treatments are becoming more precise in surgery, radiation, drug therapy. And as I've mentioned, immunotherapy is this amazing thing that we have yet to fully realize in terms of combating cancer. It's a journey for all of us. When I started in pancreatic cancer, we literally had no active drugs. Over time, we've developed drugs that are somewhat active in pancreatic cancer, but we have a long way to go. Precision medicine is just getting started in that field. In other cancers, we've come farther with precision medicine and targeting therapy. But these are great times, I think, for the world in terms of prevention. We know that certain viruses we have vaccines against that can reduce the risk of cancer. We need to have better food. We need to reduce pollution, alcohol, tobacco intake. And the future, I think, while it appears grim in many ways, is very bright. I think with using science, vaccines, healthy lifestyle, cleaner water and air, we will see reductions in cancer mortality in the years to come.
Thank you, Dr. Wolf. You mentioned the word drugs, the development and treatment, development and techniques, and that definitely leads me to Ashraf Malak. You know, when you talk about drugs, when you talk about pharmaceutical products, I'd like to listen to your perspective usually pharmaceutical companies, or let's say the idea we have about pharmaceutical companies, they are only business driven, business oriented. They don't care about the patients. They don't care about whether this is, a cancer patient or a MS patient. What they care for is to make more revenues. And I believe what we have lived now, the past 2 years with the pandemics and with the vaccines, etc., made us even think more about that and made this idea a reality much more than anything else. From our own perspective, do pharmaceutical companies think about the patient? What do you do to help patients with low incomes? Do you care about eradicating this disease, or for companies, excuse me for the term, for this question, do they only care about sustaining it and making it continue and sustain so you can eventually keep on selling drugs and making more profits and more revenues?
So thank you for the question, and I hope you don't believe in this. So, actually, I'm really thankful for that question, because that will definitely give us the chance to more deliver on clarifying our mission and vision as a company, right? So MSD as a global biopharmaceutical company, and I believe this is the case for all of the pharmaceutical company, our mission is to improve and save lives. It's all about the patient. It's all about Mary. It's all about the patients that are seeking treatment and help. So the patient is at heart of our all activities and role. And if you link always, when you mention pharmaceutical company, as Dr. Robert said, that pharmaceutical company comes always with the innovative medications or vaccines that meant to improve lives, or meant even to eliminate, for example, in cancer, to eliminate cancer. And the profits, definitely they are always there, but the profits, they have one single main role, which is to reinvest it into research, because it's very well known that it's all about research. If you don't invest in research, you will die as a company. And the research in the pharmaceutical company, it is really extensively expensive. For example, MSD, as an example, that we invest every year around $10 billion of our profits back into research to come up with a new medication or to come up with a new vaccine to help the patients. And this is why that MSD has been founded like 130 years ago. And we're sustainable and will continue, not because of our profits, but definitely because of the innovation we bring to our patients. And having said that, and I really would like to take the opportunity to even elaborate on the role that the pharmaceutical companies and MSD now is playing, especially in the UAE. The theme of this World Cancer Day is close care gap, right? And we are here today in this town as different parties of the ecosystem, as with a clear message that we are all here to find solutions for our patient. And a big part of that is how to work with Dr. Hamid and the Emirates Oncology Society, with the Friends of Cancer Patients, to raise awareness around the disease, so we can help the patient to early detect the disease and definitely have a better chances of surviving and definitely of life improvement. So this is in basic is our role, is keep investing to come up with the innovation and keep partnering with the different parties of the ecosystem to make sure we will try to improve every single part of the patient journey.
Perfect. Thank you. Dr. Peters said that the number of 18 million is going to drop to 13 million next year. And by 2040. And Dr. Wolf said, we are living great times in terms, of advancement in medicine. I'm quoting the word that you have used. My question goes to you, Dr. Rana Haji. After what we have heard and listened to, cancer is treatable. Cancer can be prevented, but in different communities, People do not even know what cancer is about. We need more awareness. What can we do from an advocacy and policy perspectives? What are the major challenges preventing us from treating cancer properly and from allowing people to understand the importance of awareness?
Thank you very much, Ricardo. I will take my mask. I saw them, the only one wearing a mask. Sorry, I have to travel. I'm WHO, but I have to travel in a couple of days. Thank you very much, and it's great to be here. This is actually very exciting and very inspiring. And just listening to all of you, I do strongly believe we live in great times, as they say, despite COVID, the worst of times and the best of times. For cancer in particular, I fully believe that these are amazing times for cancer. Actually, I grew up at the time, even though I'm not that old, but I grew up at the time in our region where this cancer, this disease, is never referred to by name. They used to call it that disease, هيدا المرض. That's how we called it. I used to wonder, ask my parents, what's that disease they're talking about? Because they were afraid. They were afraid of the disease. Fear is a major issue in our ability to get early diagnosis and better care. We need to overcome the fear. I strongly believe that we have learned so much about cancer over the last, let's say, 30 years probably. And a lot of it is due to the research, to the huge investments. We should never forget that. Research is saving lives. Research is not just to come up with a new paper. Research is to save lives. Our better understanding of cancer has led to much better prevention and treatment. Since you mentioned the prevention, Ricardo, before I get to your main questions, what we need to do, I would just like to emphasize a couple of issues, because cancer is not just treatable right now, it's preventable. It's preventable. A huge proportion of cancer is either completely preventable, or at least we can prevent the severe complication. I would emphasize that, because if early detected, we are preventing death and complications from cancer for years and years. And the survivors now, with some survival rates of cancers like breast cancer with early detection is huge. I think, I think my clinical colleagues can correct me, but we're reaching 5-year survivals of what, 99% with early detection of localized tumors. I mean, this is amazing. This is much better than, I'm an infectious disease specialist by training and a public health expert, but this is better than many infectious diseases right now. I never thought I would say that. So we need to believe, we shouldn't be afraid, and we need to believe that it's preventable and it's treatable. What was mentioned earlier about the prevention, almost 1/3 of cancer is due to preventable factors like tobacco. I would emphasize again, please don't smoke. If you hear one message today, smoking can prevent cancer and so many other diseases, and it's a scourge in our region. Many other, of course, poor diet, physical inactivity, the alcohol, increased alcohol use, all of these are preventable factors and things that is in the hands of every single person to prevent cancer. Specifically, and the link to infectious disease is amazing. I think we're now all living in times. I'm a vaccine expert by specialty, and vaccines cannot be a solution for everything, although some of us used to believe this. But as we have seen with COVID, vaccines are saving lives. We have now many cancers that used to kill people and kill women are fully preventable with vaccine. Can you imagine? Cancers have become vaccine preventable diseases. I want to repeat that. Cervical cancer is vaccine preventable. Hepatic cancer is vaccine preventable. We have 2 major infections, hepatitis and HPV, human papilloma virus, that are actually causing infections that we can prevent. By vaccinating our daughters, we can prevent them from having cervical cancer. Who has a daughter who wouldn't want to do that? So that's, I think, the issue of prevention is really critical, or at least prevention of complications. I would really like to do that. What we should do, of course, all our colleagues have commented on the importance of awareness. Awareness is critical. Our biggest enemy is ignorance, fear, and just complacency. A lot of time, I lost my mother to cancer, unfortunately. It wasn't one of these obvious cancers. It was renal cancer, a sneaky cancer that kind of like just sneaked in on her. Healthy, beautiful woman. We lost her within less than a year because she wouldn't listen and go do her, because she was very afraid of cancer and wouldn't even do regular screening. She was afraid of the cancer. But if people are doing regular screening, basic physical exams, regular checkups, this is what needs to be done. And also, if as WHO, we bring people together, and that's why it was good for me to listen to everyone also first. But also we, maybe if I may use the word push, we push for policies and for strategies. We need policies because for many of these cancers, they need policies to become accessible to everybody. If countries, I'm really proud to be in UAE. It was one of the first countries in our region that introduced HPV vaccine in their national immunization programs. This is a huge achievement. We have few countries now following suit, but this is a national policy. That's why it will not just reach one person, 10, 100, it will reach every single kid in the community or every single person who's at high risk. So as WHO and as countries, what we can do is develop the right policies, the right strategies that will lead to better access to preventable tools and treatments, as well as to improve treatment, the care gap you talked about. WHO, we believe that health is a human right. Every single person has access, should have access to the best quality, what we call health services, whether it's treatment or prevention. And as such, it is our job as governments, as communities, because the role of the community in actually mobilizing their governments is critical. Community engagement, what we have seen, the support, I think, that also what we heard about for cancer patients, we have had a huge increase in the level of community engagement, civil society organizations. Really, for me, in our region here in particular, it's been very nice to see how the civil society has pulled together to support. So cancer, to really fight cancer, and I love Mary's spirit, we have to fight it. We have to fight it, and we should not, like we fight so many things in this region. Every single day we wake up and have so many things we fight. We have to fight it. We should not surrender, but also we have to be smart in fighting it, because we have tools in our hand that will allow us to do a good fight without losing too much of ourselves. Thank you.
Thank you. Professor Shamsi, I go back to you. We know that several factors affect one's cancer journey and his or her ability to undergo a proper treatment or a regular screening that can lead eventually to timely diagnosis. It can be geography, education, finances, gender, to name but a few. So it's not a surprise that today's event is all about closing the cancer care gap, when we know that we have the scientific means to treat a lot of these patients if they show up on time. What are the latest screening recommendations for most common types of cancer?
Thank you so much for the question. I think the common cancers we screen for, and they have a very clear recommendation, including breast cancer. Breast cancer is one of the most common cancers after lung cancer worldwide. And now the breast cancer screening actually varies between countries. In UAE, the breast cancer screening started at the age of 40 because the fact that we're seeing more and more patients with early onset breast cancer in the region. And there is some discussion also to lower this a little bit even for younger than 40. Lung cancer also is one of the cancers that, the program has started more recently in the country for smokers, taking into account the number of years smoking and also the age of the patient at the age of 50. We have also the prostate cancer screening program in the country starting at the age of 50. We have also the cervical cancer starting at the age 25 if the patient is sexually active. So we do have very clear guidance about the recommendation for screening. But the problem is, how can you persuade the population or the public to go for screening? Some of the numbers in UAE actually are less than 10% uptake of screening when it comes to the breast cancer screening, when it comes to the cervical cancer screening, and these are very well established screening. And again, the aim from today is to increase the awareness, make sure that people are not afraid talking about cancer. And I completely agree with you. People are actually don't want to even mention it, but I think things are changing now. We're more open than 10 years ago, at least here in the UAE. We are more open about discussion about cancer, risk factors, and also the discussion about when should we go for screening, and also if you have symptoms, you should go for screening. For example, also we used to see more and more patients that, with the breast cancer, they are actually delaying their presentation, and actually there are some studies from the UAE showing that these patients are actually afraid. Also, there's some stigma about breast cancer, so they're trying to avoid going to the doctor, so their spouses or their family are not they look at them in a different way, or even they don't even lose their job. So I think things are changing, and clearly that you are actually raising the voice here of patient, and being a patient advocate is very, very critical to show that you can live a normal life even if you have an advanced cancer.
Thank you, Professor Shamsi. Professor Peters, well, we all know there are major obstacles that are standing in the way of many segments in the society to get access to care. Are these obstacles the same across continents? In other terms, how would a cancer patient's journey differs from the journey of someone in the Gulf, for instance, someone in the States from someone in the Gulf or in Europe?
Yeah, thanks a lot for this question, which sounds particularly relevant after what we just experienced with COVID, right? Because COVID is a very fast illustration of the diversity of health systems around the world. How fast can care be given to someone? What is, I would say, the capability, the ability of the system to adapt to needs? And we spoke about the 30 million cancer cases, right? And how fast can the system adapt to the needs? And the last thing we discussed is how fast can the drugs, the components of the treatment, actively reach the patient. So all of these parameters have been nicely shown by COVID, with some countries being fully vaccinated, like probably ours, and some countries still dying from COVID without any decent access to vaccine. So it's a good illustration. You have to imagine the timeline is way longer, but cancer follows the same path. What I mean by that is every country is characterized first by cultural aspects that were nicely described, and I didn't know about this wording about cancer that you did experience. I didn't know that. I remember having trained in Italy, in South Italy, when I was very young. And in this country, in the south of Italy, you couldn't say neither that the patient had cancer. So you knew about the disease, but cancer was not told neither. But I thought it was something which had gone already a long time ago, but I heard you had to face this problem longer than some of these regions. So culture is different from one region to the other one. So second thing, of course, is economical aspects, where it's not something, and I like the idea of the collaboration with the pharma industry, it's not something which has no solution, but it has complex political solutions. What I mean by that, it's not black and white. Pharma industry is not only for profit, but it needs profit, first of all, to perform research. And we underestimate the cost of research. And research is not only new compounds, it's a requirement, a very demanding environment to have a drug being accepted by the authorities. It's millions, hundreds of millions, to run clinical trials to prove it works. So, I mean, this is something that the pharma needs, and they also need money to construct with us solutions which are more compassionate, which might support the countries in which it might be in the future less rentable to make the drug arrive. It's a huge construction, right? It hasn't been the priority in all countries until now, because now it has been delayed by COVID because of drug development market, but it has to be the next priority. Remember, on the hands of WHO, sustainable and accessible cancer care is a goal, is one of what we call sustainable development goals, one of the major goals for the future, accessible and sustainable cancer care. So of course, the politics and economy is one thing. And last but not least, I think we live in different environments, right? But we need to face infectious diseases. Think about HIV. We didn't speak about HIV, but HIV is the main driver of cancer still in many countries. So we need to understand that each environment needs the own set of doctors to tell how to live and how to move in order to make sure that cancer might be detected early or might not even happen. So all of this define, right, the different environments, but none of these cannot be addressed. They can all be addressed. But maybe we should do as doctors a little more of politics, because there's a lot of political topics swimming in this middle. And just to speak about wording of cancer, it's very important. We spoke about it for COVID, but Gandhi, the Indian politician, was telling a very nice sentence. He said, the enemy is fear. We think it is hate, but it is fear.
Thank you. You know, the first time I've heard about cancer, I believe I was 6 or 7 years old. I had a childhood friend of mine. He was my neighbor. And every Sunday, there was his cousin coming over. This cousin had the same age, and she had cancer. And I remember whenever, you know, she sprung up, and whenever we used to see her, used to say, that girl, you know, has cancer. And we were so afraid to look at her. You know, the perception of a cancer patient has always been something very awkward. Of course, the thing has changed along years and across the time. And like Dr. Haji said, we used to call it that disease, هيداك المرض. Now people are talking about it, you know, like Mary did. And what I would like to do now is to invite you to listen and to watch another cancer survivor, you know, who has given us a testimonial, a remarkable one. His story is inspiring. Let's listen to him. His name is Bassam Ismail. He's Lebanese and he's specialist in medicine, physical therapy.
مرة خبروني إنه أنا معي سرطان، كان لي جمعة بالمستشفى بسبب مشكلة بالقلب كان سببها السرطان. من بعد فحوصات وتحاليل وصور بين إنه في أورام موجودة بقلب الصدر تحت الباط وبالرقبة ومنتشرين بكثرة وواصلين حتى للمعدة، فقرروا ساعتها ياخذوا خزعة منه وبين ساعتها إنه في سرطان بالغدد الليمفاوية عندي. أنا بهاللحظة حسيت العالم وقف، حياتي كلها وقفت، بلشت الأفكار منها لحالها تجي. شو حيصير عندي هلا؟ كيف رح اتعالج؟ هل رح اقدر ضلني بهالعلاج؟ هل رح اطلع عايش بالاخر؟ شو حيصير بعائلتي، باختي، بشغلي، باحلامي، بطموحاتي؟ وبكيت رفضت هيدي الفكره وقررت قاتل بكل شيء عندي اياه من قوه لاتصدى لهالمرض واطلع اقوى منه وحافظ على احلامي وطموحاتي وكون موجود هونيك مع عائلتي. تجربتي مع السرطان علمتني كثير قصص، وهي قصص ما كنت فيي اتعلمها الا لامرق فيها. أنا أول ما فتت على أول عملية زرع لإلي كنت حاسس حالي فايت على عالم مجهول، قايلين لي فايت على عزل يمكن تقعد شهر جوا يمكن أكثر. شو حيصير جوا؟ شو في جوا؟ شو هي هالغرفة الغريبة اللي عم يحكوني كلهم عنها؟ أنا أول نهار فتت فيه لجوا قعدت أتأمل بالباب لبرا، عم شوف الدنيا كلها عم تمرق، الناس رايحين جايين وعم بحس أنا حياتي اليوم واقفة هون بس الدنيا برا كفاية. ثاقب حظي حلو، ثاني نهار ظهروني لأنه مناعتي كانت واطية. رجعت بعزيمة قهوة لأنه كنت عارف شو ناطرني جوا، أخذت فكرة كونتها جواتي واستعديت لها. جيت أنا عم بقول لهم يلا خلوني فوت، خلوني بلش كيمو، بدي أخلص، ركبوا لي سنترال لاين، أنا ريدي. أنا وبالزرع قعدت كل مرة شهر بهالغرفة، كل مرة كنت فوت معي بلاي ستيشن، كتبة، درسة، موسيقى. أهم من هيك فوت معي القصص اللي بحب أعملها. بقيت عم بتعالج 3 سنين، بس بهالفترة كنت عم بدرس من قلب المستشفى. وضليتني طموح فيها الى ان خلصت علاجاتي ومن بعدها بفتره تخرجت. وانا من القصص اللي عملتها هي اني كنت انزل دائما على السيشنز تبع الكيموثيرابي لابس جيب سوبرمان، كنت حاسه بتعطيني قوه، بلس لما يشوفوني الباقيين جوا يسلموا علي هاي سوبرمان، تعمل احاديث مهضومه بيني وبين السرفايفرز الباقيين. لما خلصت انا اول زرع بلشوا اشخاص غيري رح يخضعوا لها يحكوني يسالوني شو هو بون مارو ترانسبلانت. كان عندي صور برهن لفرجيهم اياهم خبرهم شو هي هذه القصه. هذا الشيء هون لهم تجربتهم لهم. وانا اكيد لو كان في حدا قبلي عمل هيدا القصص وكان عنده هالادله بايده وفرجاني اياهم كان هون لي تجربتي. ما كنت فت لجوا خيفان ماني عارف شو ناطرني. بليف فايت وين. وانا مثل ما خبرتكم بلشت اول شيء باني امن بحالي بالباتل تاعيتي. من خلالها صرت قادر اقاتل لو شو ما كانت الصعوبات اللي رح واجهها. فعلا اطلع بالاخر منتصر بحياتي. دائما خلوا بوزيتيفيتي والنفسيه القويه موجوده على طول، انه هي اللي بتعطينا امل انه نكفي وما نستسلم باي شيء بالحياه.
Bassam Ismail, thank you. Mary, my question to you, when you encounter and you get to know or you meet a cancer patient, what do you feel for him or for her?
Actually, thank you for this, because this is what I try to focus now at. Because first, you mentioned about awareness, and the most important when we meet, especially if you are the survival and they see you, how you move, how you continue your life, you manage to change their perception that this is not the end of the world. This is just a change in lifestyle and it will over a phase. And you can tackle them. Like I would say about 3 experiences I passed by. The other day I was in the mall and I realized one of the shops have put, 20% discount for cancer patients. I was intrigued. Shall I get my report? I get the 20% discount. And I chat with the girl. She is poor with the minimum insurance coverage. She has lumps and she's scared to go, to lose her job, to take day off, to die. And sat with her for 1 hour and dragged her to the hospital. I paid it from my own as other few girls, but later on they put into the system and they are fine now. They were in grade 2, so they managed to go with minimum treatment, with more treatment, and now they are happy. And we talk even with their organizations to help them continue their work and their salary and income without having the fear for their future and for their family. And this is what matters. And for me, every time when Bassam spoke about going to the chemo, for me it was kind of fun, drive myself there, sit, finish my work, then gossip with the rest of the patient. And on this gossip every day and laughing, telling them jokes, I realized how much I'm lucky. All the things which I've thought in my life is not super positive. Actually, they were good. I was happy that my parents are dead, so they don't need to face this. I'm happy I don't have siblings, so they don't face this fight along with me. I was happy that my company stands for me like a hero to the end, and still they will. I'm happy for my friends, how they come together and the family collaborate when they see it. There is a lot of positivity in it. There is a lot of things you can give and you enjoy. It's a new lifestyle. Raise awareness, talk to people, change perception. When we succeed, when we continue, we help others to continue. And this is our duty to continue to the world.
Thank you, Mary. Further to what you said, Professor Wolf, that brings me, of course, to an issue that is very important, which is the mental well-being of patients beyond physical health. An important aspect of a patient's cancer journey that is seldom tackled, the impact of this experience on his or her mental health and well-being. How are institutions tackling this important issue? And how important is a strong support system in a patient's overall reaction to treatment?
Yeah, this is, I think, a very important part of cancer care delivery. And I think it comes in a variety of ways. So at our institution, we tell people we have a mission, and our mission is to eliminate cancer in Texas, the United States and the world. And people who work at my institution believe in that mission. And when they meet patients who are facing cancer, who are coming for treatment or surveillance, they are welcomed, they are respected, they're asked how they're feeling. And I think this is a very nurturing environment for patients. And our caregivers, whether they be professionals, family members, friends, need to provide this support for the person who is the focus of the attention. And there's no question in my mind that having a positive attitude, which can be difficult to come by at times, is critical to the success of any treatment. It, one, helps patients, I think, endure the treatment. Two, they have more of a feeling that they're doing something for themselves. And three, that they know that there are people all around them, both the professionals around them and their loved ones, who are rooting for them, who are trying to support them however they can, helping them in a wheelchair if necessary, helping them get transportation back and forth to the hospital, sitting with them while they get their treatment. Beyond that, we try to provide counseling services. There are people who are actively struggling psychologically, and we need to acknowledge that and help them. We have medical therapies for that, but we also have people who they can talk to. Support groups are critical, I think, for many patients, to see somebody else who's gone through the experience they're going through and to see them come out the other side. I think it's very empowering. So it's a critical part of cancer care. I think it's underappreciated in many arenas, but I think it needs to be front and center for all our patients. Attitude goes a long way. Your young man from Lebanon just demonstrated that with his thumbs up, his Superman attitude. And I think this is critical to successful treatment, minimizing the sense of how sick you are and really saying, I don't feel well, but I can push through this and I can get to the other side.
Thank you. Mr. Ashraf Malak, of course, when we work in a pharmaceutical environment, everything is based on data. Everything is based on surveys, on numbers. Can you give us more or less a hint or an idea about the local data and the market in the country?
Yeah, exactly. So I think that the name of the future is all about data. And for any government, if you want to drive a better healthcare system, you want to make decisions based on data. And here we will see that we as a pharmaceutical company, so we as a pharmaceutical company, we play a major role to partner with the health authorities in the markets where we exist, to partner with the markets to make sure that we work together to provide meaningful data to help them to make the right decisions. So I'll give you some examples of that. So across the world now, we used in the past to run like central clinical trials. Like we used to have a couple of centers, 4 or 5 centers across the world where we do our trials. Now, for example, for our immunotherapy treatment, we have currently 1,300 clinical trials are being run across all the world to make sure that you want to provide local data to that market, data that they really can make decisions on. In addition to that, it's not only about just clinical trials. We are now exploring the chance with opening dialogue with the health authorities in Abu Dhabi, in Dubai, for example, as MSD UAE, to look into that, how can we work together to process the data that you have. Here in UAE, there are one of the best countries in the world that they have a good data infrastructure. But the question is that how you can process this data, especially when it comes to the cancer, how this could help you to make better decisions, how this will help you to make better screening campaigns or better treatment, or even decide on the efficacy of the medications or treatment that you have. And for this, that we're opening dialogue with the different stakeholders like Abu Dhabi Health Authority, like some universities here to work together to see that how we can process the data in the bank to make sure it will be more meaningful for the government here to make the right decisions on cancer treatment. And this will keep evolving. In the future, we will look into how we can apply artificial intelligence to make decisions as well in different areas. And again, this again improve one fact that to close care gap, it's only by partnering. It's only by having all players and all parties of the ecosystem working together towards one clear objective, how we can help the patient.
Thank you. Of course, in this panel today, we have tackled the issue of how to better protect ourselves. You have pointed out, Dr. Peters, to the importance of diet, nutrition. I think Dr. Wolf as well, he has mentioned the physical activity, the positivity. We have also tackled the being surrounded, the care of friends, of families. Mary, you have mentioned that. That brings me, of course, I think we've discussed it, but still, I wanted as a brief answer from Dr. Haji, because she kept on repeating the word policies, policies, policies all the time. So achieving those healthy patterns that will increase our chances of combating cancer as individuals and as humanity. It requires an integrated action from all sectors of society, including civil society, institutions, government, private sector, health entities. What is the concrete way forward in terms of policies and guidelines to close the care gap when it comes to a disease that is deadly as cancer?
Thank you very much, Ricardo. So now you want me to wrap up everything we talked about.
I think, we still have a few minutes and we need to benefit out of those few minutes.
No, I think this is a very good question, but it's multi-pronged question. I think some of the issues that have already been commented on by all the colleagues, the issue of data, maybe if I can get first, this is one of our biggest challenges in the region, data. Because, with data, everyone is responsible. Data, every single physician, I think Dr. Solange was saying that physicians have to get into the politics to deal with awareness, but physicians need to get better at recording the data. I mean, I was a house officer and we used to record deaths, in the middle of the night as somebody died from cardiovascular accident or whatever. One of our biggest problems, even convincing governments to do more and to put in the right policy, is they don't have data on disease burden, especially with end-stage disease, or even, sometimes we have still death at home in the region. So these poorly recorded causes of death. So we need better data systems. And I think in this age now of big data, digital health, it shouldn't be that hard, but we need strong electronic medical records. We need cancer, not just surveys, we need registries. We need to have very strong data system, and we need our governments to invest in having these data systems. And I think, again, being opportunistic, I like a novel by Gabriel Garcia Marquez, Love in the Time of Cholera. I call it now, we are doing public health in the time of war. We are in a war against COVID. We are in a war against many things. And what governments learned with COVID very quickly, that without data, the countries are going to shut down. So we have to be opportunistic. They understand what data is for. And they know that without data, they cannot make decisions on what vaccines to introduce. What are the top, I want to go to a country and tell them cancer is killing, I don't know, WHO is always a bit more conservative. So we estimate 10 million worldwide, right, in 2020. But if I want to tell them a few thousand, I want to give them data so that I convince them that they should invest into putting a new policy for prevention of cancer or for even improving cancer treatment. So I think data, again, I would say again, data is really critical and strong information, health information systems. What you mentioned and what already was commented on is with this whole care, closing the gap of care. Care for cancer, like many diseases, is a continuum. It starts with prevention, I would say, to early detection, to diagnosis, to treatment, and then palliative therapy. Right now at WHO, when we talk about essential health services, this includes prevention services, such as immunization and many others. It includes treatment. It includes palliative therapy. Palliative care is a huge, very, very critical for cancer. And it's one of the areas of care that are really not much invested in most of our countries. And of course, it includes rehabilitative services for patients who survive. So that's a continuum. And as you very rightly mentioned, Ricardo, it's also a multi-sectoral approach. Again, it's a concept that is gaining a lot of now appreciation, because even with COVID, we talk about what we call the whole of government, whole of society approach. It's not just ministries of health on their own were not able to handle COVID. They needed ministries of interior, they needed the Ministry of Defense in some countries, they needed the Ministry of the Environment, they needed the private sector, the community engagement. So the multi-sectoral, the private sector is critical. I think, I mean, thank you for that question, although I know we put Mr. Ashraf a bit on the spot. You know, with the pharma industry, they're not just about making profit. You know, many of them have foundations that have provided a lot of support for research. Similarly, we have been engaging now in partnering more with the private sector. The private sector is not just about making profit. Of course, you know, they want to make profit, but the private sector, especially in our region, is playing an increasingly important role in also being part of the overall continuum of care. Speaking of that, like WHO, we recently started a new initiative that was endorsed by all the countries for breast cancer, the Breast Cancer Initiative. It had three main pillars. The first pillar was early detection and screening. The second one was about diagnosis, and the third one was about the full care. And you know why it's important for us to have these endorsements from countries. Once countries approve, you know, whether it's in our World Health Assembly or whatever forum, actually, we just had our executive board meeting last week. Once they approve it, then there is a commitment to put the resources into it. So that's where.
Thank you, Dr. Haji. That brings me to a question to Professor Al-Shamsi. Beyond individual and collective efforts, we all agree that a timely diagnosis can mean the difference between life and death. Catching a cancer at stage 1 or at stage 2 means a smoother treatment and hopefully a speedy recovery. What is standing in the way is, among other things, this aura that cancer has surrounded itself with. How can we demystify cancer?
I think we answered maybe this question partially earlier. I think the way to end cancer is by having more research, to have better understanding about the cancer. Cancer is a very smart disease. It can adapt, it can changes. So we need to have a better understanding. Our understanding now is much better than 20 years ago, but I still think we are still way behind understanding the full picture. It's not about a single gene that causes mutation and then causing that being the driver of the cancer. There are so many other factors we're still trying to understand and learn. So understanding the cancer is a very critical component. Number two is I still think prevention and early detection is the way to go at the current time with our deficits in knowledge about the cancer. Trying, as you mentioned, trying to diagnose these cancers earlier. The earlier we diagnose cancer, the better the chances patient can survive. In general, patient with stage 1 or stage 2, they can have survival 80, 99, 80 or 90%. Patient with stage 4, most cancers, their 5-year survival, not more than 5 or 10%. So the understanding the cancer, trying to act now by increasing the awareness and getting people as well to screen is very critical component. And I think I should mention also in my previous answer about the newest modalities of screening, which is the liquid biopsies or liquid screening of DNA or blood. These tests are in clinical trial now in the UK and the US. For example, the CancerSeek in Johns Hopkins and also the GRAIL trial in UK. This will change the way that we screen for cancer. Very small amount of blood. It can be done for older patients, younger patients, risk factor, no risk factors. I think also will be able to omit, mammogram, CT scans, or maybe they can work together. But certainly, I think the future is bright when it comes to AIDS detection and screening.
Professor Peters, we live in an era of millennials. This is the era of young generations. Young people are supposed to be youthful, but a disease or cancer can tackle and attack anybody. How can we reach the younger generation and work on raising awareness during this digital day and age?
It's an interesting question, particularly I understood for your country where you have an over-representation as compared to the rest of the world in a young population, right? Young people, which is amazing to me. I got to learn the numbers, but you have a very young country. So how can we, I would say, kind of work with them or even rely on this new generation, right, to be actors of the fight against cancer? I guess that's your question. So the most important thing is what we do today. And maybe today there are lots of young people in the room, but I mean, what we do today is about trying to convey messages about cancer prevention, about what should be without any perfection, right? Nobody's perfect, but without any perfection, but having simple messages about what should be a balanced life in which you can eat, drink, or do whatever you want, but without abuse and without addiction, right? You have to move and all these kind of messages are messages which just can be driven by the young generation. What I mean by that is it's an attitude, a way to live, is something you start to adopt, you start to define when you are 25, 30, not when you are 55, it's too late. So what I mean by that is we have to make them contribute. It's not difficult because we see the young people in the medical school, in the biology school, in the training for diplomacy, in the training of pharmacy. So, I mean, we see these people, so they are part of this game. So we need to make all these young people contributing to all these good messages. So most important one, for example, we have a big fight now in Switzerland, is to let them being aware of these topics. We have still in Switzerland, because of economicity of things, a huge advertisement for tobacco. We have 3 big companies in Switzerland, the largest in the world plus 2 others. So I would say the lobby of tobacco is very strong. So if you move in the street in Switzerland, you have advertisement everywhere for cigarettes and tobacco. In most of the European countries, WHO has an important guidance in that. It has been banned. So what can you say? Can you really make it change? Not really, but you can make your young colleagues, friend, my son, being aware of what it represents. Smoking is not cool, it's not fun, it's not pleasure. You're not better if you smoke, despite the advertisement suggesting that. It's quite important, right? In this country, in my country, they followed a teenager during a day of the weekend. He saw 75 advertisements for smoking around his way, in the bar and so on, 75. So, I mean, we need just to make this more clever than we are a generation of young people being part of everything we do, the training for being an investor, of being a doctor, a physician, a biologist. And it's maybe the most important thing we can do, or maybe the most successful thing we can do.
Thank you. To end this panel, and because we live in a post-COVID world, I believe we cannot but tackle the repercussions of COVID on cancer patients. And this question goes to you, Dr. Wolf, especially that you are tested positive. The cancer patients are now more vulnerable and they are part of the at-risk populations, and they attempt or try to skip screenings. They try to avoid going and see doctors to do their checkups. They fear catching that virus, and eventually they miss undergoing their test. How are the institutions alleviating these pain points?
It's a great question, and we spend a lot of time with our educational materials for particularly our new patients about what are the steps we take within our hospital to minimize the risk of developing, of contracting COVID within our walls, but also what people need to do at home to keep themselves safe. We're at a different point in the pandemic now than I think we were initially. And it has been clear when we've had a reduction in virus spread in the United States that more people sought medical care for other problems. But once the numbers start to increase, it prevents people from going for care. But we've put a lot of things in place to try to protect our own population. You know, we have one of the most immune compromised inpatient settings of anywhere in the world. We have a large stem cell transplant program. We have a lot of patients getting cellular therapies for lymphomas and leukemias, et cetera. So this is critical for our population. I think once the pandemic numbers start to settle down and we're in the endemic phase, I think the biggest message to people is we go to the eye doctor, we go to the dentist, we go to our general practitioner. We need to get in the habit of keeping our immunizations up to date to include the COVID-19. I think this will probably become an every 6 months and an annual booster that we all take for at least the foreseeable future. And that if we avoid doctors, if we avoid going for dental care, vision care, we are going to cause problems for our bodies. Life is given to us and we have to cherish the bodies we've been given. And it needs to be really starting at a very young age. People need to understand that they have to take ownership of their health. There are things we can do to have healthier lives, more active lives, more enjoyable lives. This helps not just our bodies, but our brains. We see clear indications that physical activity actually prevents dementia or reduces and slows the progression of dementia, et cetera. But, you know, linking COVID, which I think everybody has seen the impact in the delivery of healthcare beyond cancer patients, but also cancer patients. We need the vaccines clearly are active. They're going to be active against cancer. As it has been mentioned, hepatitis, HPV, cervical cancer, head and neck cancer. These things are preventable with vaccination. And we need to continue to bang the gong that keeping your immunizations up to date, both for coronavirus, for influenza, make sure people are vaccinated. I think governments really can, the low-hanging fruit is immunizing your populations and providing as clean water and as healthy air as can be obtained, and educating people about plant-based diets predominantly, and helping us all. But the coronavirus, I think, tells us that if we're active in seeking care to prevent the coronavirus, it sort of seamlessly goes into prevention and early detection of cancer as well. And you need to face that and take ownership of your own health to be a partner with your care providers.
Thank you. Let's give the floor to the audience if they have any questions. I think we can dedicate 5 or 10 minutes. We need microphone, please.
Thanks for the opportunity. This is great. I just had a few comments and maybe a question. So I started the field in oncology in 1990, actually even before. But anyway, I don't look that old, but it's been a long journey. And what we did in 1990 is completely different what we even dream of doing right now. So I think that's also, we're talking about research and money in research. Yes, drug company make money, but they are reinvesting. A lot of companies, not just MSD, but a lot of the companies are reinvesting in research. Because without research, you cannot do all these hundreds and thousands of clinical trials. They cost lots of money. And so certainly we salute the drug companies. Besides, we all blame them for making everything so expensive, but this is reality, unfortunately. How much sustainable is going to be looking forward with every new drug is at least $10,000, $20,000 per one patient per 1 month. Just 2 weeks ago, a patient paid out of pocket about $20,000 for 14 tablets. So it's really outrageous sometimes when you look at pricing for new drugs. Yes, they are new research, we have to pay for it, but they are not curable, potentially. So yes, they may make people better a little bit, but ultimately they are not curable. So my question, I guess, to pharma also, where are we going with this? We know in the US, there are a lot of studies saying, well, this is not sustainable. The system is going to break. You cannot have a budget of just for health that is going to be more than anything else. Almost 50% of the US budget projected is going to be for healthcare. So I think we need to start thinking now, where are we going in the next few years, just to keep this a sustainable thing. Not everybody is going to have CAR T cell. It's $500,000 per one person. And again, half may be cured, half may not be cured. But are we ready to put all this money? And of course, that's going to spike our premium for every one of us. If we're going to have good insurance, that's going to spike, the premium. So what are we doing, thinking ahead to really keep this research ongoing?
Cool. No, thank you for the question, Doctor. I think that if there is one thing that keeps us awake at night is a question that how you can really be sustainable with this additional cost of coming up with a new product or a new medication, and spending all that money on the clinical research is really costly. There's like the cost of coming up with a new medication, it came up for 3-4 folds in the last 15 years, right? And this is really a challenge. And you can see that as a company, sometimes we try to help through giving license for some countries who cannot really afford it. So we try to do financial reward, but it's not sustainable, right? So the only way to do that, and this is what we try now to see, that how you can come up with a new technology and coming up with a new medication. For example, that we could see that a lot of vaccines for COVID treatment, they broke the record, like instead of having 5-6 years to come up with new medication, this new technology and the data and applying artificial intelligence in producing a new medication has helped a lot the companies to come up with probably less costly process to come up with a new medication. So we believe that it's only about the technology, and the technology, we believe it will keep evolving. And with this evolution of the technology, the cost of coming up with a new medication, even the time of coming up, because the time is money as well, the time to come up with a new medication, it will become probably more reasonable. So I think this is really a big question, and this is exactly why you will see that now there is, for example, what I have read in the report of the WHO, 70% of patients who die because of cancer because they don't have affordable solution to buy, not only to buy the medication, for the whole process to stay in the hospital, to take chemotherapy, and so on and so on and so on. So I think that the only thing to do that is by initiating such discussion, to talk to the governments, to talk to the different stakeholders, try to find solution. For example, last year here in UAE, after multiple discussions with the Minister of Health, we were like putting this question on the table that we have some low-income people in UAE who cannot really afford the medication. So we worked with them, with the Minister of Health and with the NGOs to launch a program called Audit Program, whereby that we work with the NGOs to provide this treatment free of charge for the low-income patients in UAE. But this could be limited solution, and I know that the question is much bigger than giving a limited solution. But definitely, this is something that, like, top priority of the whole industry, not only pharma industry, the whole industry, even the research universities to come up with a solution.
We want to keep working, you know. We don't want to be out of a job ultimately.
We keep working, exactly.
Just one comment on stage 4 that Dr. Hamid mentioned.
She has something to say, Professor
Just
Peters.
just for the political topic, and again, I invite all the people interested to get into this discussion because that's priority. There are 2 words you need to know in this political arena. The first one is fair pricing, and the second one is reimbursement model. So you can calculate the fair price, the right price, the correct price of a drug. It's about how the research, the development and research costs, how many patients are you going to treat, how much does it cost to produce, and how long is the patent still lasting. So you can calculate the price of a drug for the pharma to gain nothing, but to lose nothing, right? That's fair pricing. But of course, pharma is for profit, like every enterprise in the world. So what you can do, like everything in the world, is to have the fair price of a drug and multiply this price by a certain number according to the efficacy of the drug, the magnitude of benefits. Like everything in this world, the success is related to how much it can help caring patients. So this is fair pricing. Imagine the fair price multiplied by 1, 10, or 20, depending if the benefit is low, good, or very good. Fair pricing. Then reimbursement model. Once you have the fair price, I will not have the same price in Switzerland as compared to Italy, as compared to Cambodia, or as compared to Western Africa. Then the reimbursement model has to be defined in order that this drug will be accessible everywhere. Both are being worked on. As ESMO, as ASCO are working with WHO to define fair pricing models and reimbursement models. It's a huge one. We need hundreds of people being involved. But if we get there at the end, we'll all be together giving access to drug to more people with a pharma, which will be of course selected to the best, but everything in our situations are selected to bring benefits, a pharma being able to continue the work. And we see the pharma is not very healthy either. We see small companies disappearing. So we need really to make everybody stronger. And these 2 definitions, fair pricing and reimbursement models, will be the solutions, but it's politics.
Yeah, we call it value-based care, right? That's what we're doing. Just on a brighter note, just 1 minute. So stage 4 disease, you mentioned 5% or less are surviving. That was when I was a fellow. I think we can very firmly say we have phase 3 data, 5 years outlook in breast cancer, you know, whether it's HER2 positive or ER positive, exceeding 60 months. So you're talking about more than 5 years, with more than half the patients are alive in stage 4, liver mets, brain mets, you name it. Lung cancer, Dr. Peter, we have now 33%, I think was the KEYTRUDA or the MSD data, more than a third alive at 5 years. This is unheard of just 10 years ago. So certainly we have made huge progress, no question. But my question was more to really, we want to sustain this progress. Like Dr. Peter, maybe value-based care should be what we are thinking. Thank you.
Thank you. Do we have any other question? Thank you.
Thank you very much. I'm Falah Al-Khatib. I'm a clinical oncologist, been in the country for 36 years. I started in '86. And I can tell you the change of attitude towards cancer and how we managed to deal with it. The problem with cancer is a dogma that cancer is dead. And that is 86, and that is 2022. Okay? So a lot of people, not everybody like our friend Mary, that educated, that had this positive attitude or whatever. A lot of people are illiterate, less educated, don't have resources, don't have access to medication, they are supporter of the family. They fear of a lot of things, a lot of confusion, and a lot without support. Now, I can tell you the attitude towards cancer needs to change, because that's for public and for government, for health provider, because 30% of cancer are preventable. But these 30% preventable are responsible for about 70% of death from cancer, lung, and other, head and neck, and upper GI, and so on. Now, so this one, if we work on this, we can prevent 30%. 30% are curable if we early detect them, stage 1 and 2, and that include breast, head and neck, lung, you name it, in any different organ. 30% are completely curable, and they live longer. And I can give you patients who are breast, who are other things, that are 30 years follow up with me until today. Now, the other 30% are controllable. They know, that's what we're talking about, the 5%, 5 years survival, which wasn't that. Now we have that. And these are curable, right? They're not curable, controllable. We can control them for a long time, 5 years, maybe 10 years later on. Melanomas, I have patients with melanoma who are now 5 years after treatment with immunotherapy, just like that, lung and so on. So, and then remains the 10% that are really very late, stage 3 and 4, that we need, pain control, palliative treatment, and so on. But still, they are a burden on the system that they need. So that's how we need to replan our resources and how we spend. And this needs a lot of money. It's not just like that. I mean, for detection, for early detection, for preventable, and so on. So this is one point that I want to say. The second point, Mary mentioned everybody. I agree with her that positive attitude is very important. Positive attitude needs to be on the patient side and on the doctor side. And this is very important, because a lot of our doctors are not positive, don't have positive attitude. I'm sorry to say that. And this is the importance of, you see, because most of the time, the break of the bad news to the patient comes to the oncologist. I mean, the surgeon push them away, the physician push them away, everybody push them away. Say, oh, you go and see Dr. So-and-so, Professor Shamsi, he will tell you. And then in the past, they go abroad, and they tell them when they go abroad to go up there, Dr. Roth, MD Anderson, they tell them that you have cancer, but they've been like that for 6-7 months, maybe 1 year in the country without anybody telling them cancer, because it was a taboo. So this is the attitude. And I'm telling you, is the first encounter with the patient is the most important point. You either gain her confidence or you break her completely.
But sometimes you've got doctors who sell castles in the sand, and who sell words.
It is. Some doctors in the first encounter, they say so and so and so and so and so, but I'm sorry to tell you that you have an incurable disease, and you're going to die from the cancer, or from this and this and that. And that's enough. That's finished.
So it's being straightforward.
Yes,
it means being what?
Yeah.
Being negative. If you're realistic and straightforward, it means what? It's a bad thing. If you're straightforward, is it a bad thing? If a doctor is straightforward,
it's a bad thing. You have to take. You cannot first encounter the patient. You have no chance. You have always to give hope to the patient, not false hope, but you have to take patient slowly.
but if you know that the battle, the anticipated battle is already lost, what do you do in that case?
Well, no, that's it. You lose the patient, and
But it's already lost.
Yeah, it's already lost. Yeah, it's a battle. It's already. I mean, what if your oncologist told you in the first encounter that you have no chance, or when you have this, and you're going to die tomorrow or after?
Actually, when I did my mammogram, before I get even the biopsy, the doctor started to cry when she examined me and told me, "You're still young." Wait, I just been informed about cancer. Why are you crying? And I hold her hand And I said, that's okay. It will be fine. We will pass it. Relax. Let's take a breath. I know it's coming from a good place. But you mentioned something very good. It's the doctor always put the best interest of our health first, before anything else, before also looking to our emotional, and not just our emotional, our family and community surrounding, because I don't fight cancer alone. My family, my friends are fighting it, and it has its impact on everyone around us. So I believe there is a need to have kind of psychological part or body that can come and manage the information flow between the medical side and the patient based on his requirement. For me, for example, I like the blunt in decent way, of course. Others might need a little bit of sugar coating or formalin. You need to get them to move forward, and you need to give them that hands to move away from the pain. And yes, I've heard the tablet. I'm still alive.
Yeah.
I'm sorry, I'm still alive. I'm proving you all wrong.
You see, I tell the patient all the complications because they have to accept, like hair loss, like nausea, vomiting, like, all this. But short of telling her or him that you are going to die.
Manage expectation in a proper manner.
Absolutely. So that lesson, how to handle the patient and the family is the most important issue, and that happens in the first encounter.
What you speak about is hope. I mean, hope is not only in health and everything. And what you try to teach to young doctors is hope is not about thinking that everything will be all right.
Yeah.
That everything, it's not. Hope is just to be able to see and manage a reliable plan. So as a doctor, what you have to give to your patient is a plan which is good, which is reliable. It's not to tell your patient everything's going to be all right, because you don't know, nobody knows. You need a reliable plan. Hope is about a plan.
But maybe if I can comment quickly, Ricardo, I mean, this is also about communication.
Yes.
Because I think as doctors and practitioners, we do not get trained on good communications, to be honest. I got a lot of training as a public health professional, but not in my medical training. And we are actually now pushing for better training on communications to better manage the patients and expectations, as Mary was saying, but also to better communicate with people. I mean, we give too many details. I mean, when you go, I mean, we're talking about politics. When we go and explain to a minister of health, why do you need this vaccine or this expensive drug? Does he or she need to know all the details, the clinical details? No, they don't. They need to know how it's going to help them. They need to know why it's actually cost effective. Actually, to the earlier question of the doctor, prevention is cost effective. It's going to save a lot of money. Health financing and the debate about health financing now is huge. It's one of the biggest things on the minds of governments going on, especially with COVID. I mean, sorry, because I breathe and eat COVID every day. So I was just giving a talk, and this number is still on my mind. We estimated the cost of the pandemic for the world. And by end of 21, we estimated it cost the world something between 30 to 40 trillion dollars, trillions. If you spend on preparedness, basically simple things, simple surveillance, response, prevention, it will cost you about $5 per person per year, which is with 8 billion people per year now, although COVID had killed a lot. So it's about $40 billion. It costs 40 billion for preparedness and better response, compared to $40 trillion that one simple virus has caused. So that's, again, I think the issue also, I mean, instead of continuing to deal with the ballooning, costs of medical care and health financing, and prevention is cost effective.
Thank you, Dr. Haji. Any more questions? No, I need to conclude. Yes, please.
Hello, I'm Mariam Gharaib, Health Policy Analyst. Actually, I have two questions, if it's okay. I have one question to Dr. Haji and another one to Professor Ahmed. Regarding global policy, in the recent, we are in Expo 2020 today, and we're talking global. So in your opinion, what do you think the global policymakers should make in order to compensate overlooking the NCD global policy in the recent 2 years, having the fact that the whole focus is on alleviating the impact of COVID-19 and bringing it to an end and to reshape policies in the future. So what should we do here in order to compensate this overlooking, which is major at NSCD level?
Yes,
Thank you.
Thank you for this question. I mean, this is a very big topic, of
Yes,
course,
thank
but
you.
I think, I mean, there are lots of policies in the world, and I know, I mean, as WHO, we have every year we keep generating policies and guidelines and strategies, but countries are not fully implementing. So the issue is not just coming up only with new policies, but having the buy-in. And what I mentioned earlier, maybe in a very short answer, this whole need for countries to take very high commitment at the highest level and to have this multi-sectoral approach to non-communicable disease. Non-communicable diseases, you need, I mean, my office is based actually in Egypt, in Cairo, where they're doing great efforts building roads, building bridges, but people cannot go walk. You know, you need parks. For example, if you want to prevent cardiovascular disease, you want to improve physical activity, you need to develop, parks. You need to have places where people can go walk. This requires working between, with Ministry of, whatever, public affairs or environment or others. So I think you need to just change the way you look at non-communicable disease altogether in terms of prevention, and not just in terms of, there's a lot of treatment. I mean, we focus, but even for treatment, I mean, if we're going to get into non-communicable diseases, I think that one of the biggest elephants in our regions is diabetes. Diabetes is we are the region with the largest prevalence rates of diabetes in the world. And most of it may not be easily preventable, for example, with weight loss or whatever, but complications. In our region, for example, blindness, diabetes is one of the main causes of blindness. Diabetes is one of the main causes of renal failure. So if we just manage diabetes well, so improving management care and guidelines can also help countries with a significant impact on non-communicable disease. So we need like a whole new approach to non-communicable diseases, especially after COVID, because now I'm afraid that actually non-communicable diseases will lose a little bit moving on, because the focus is on preventing pandemics and outbreaks. I mean, I'm an infectious disease person. I think we've been preaching that for years, but I'm worried about the focus shifting again to the communicable diseases, and then non-communicable diseases are chronic. It takes years to see an impact, and I think it might affect the policy. So we're going to need a lot of advocacy and support from the global community, from the physician community. We need every single one should be an advocate for better health.
Thank you very much.
Great, thank you so much.
Can I have the question to Professor Hamid?
Please.
Okay, thank you.
So,
Professor Hamid, actually my question to you, I know personally how you do respond to patients outside UAE. And now talking global with Dr. Hajji, I just thinking if you and the UAE Oncology Task Force are considering any kind of missions, whether globally, generally, or across the Middle East countries, in order to alleviate impact of cancer and in order to help access to cancer technologies and treatments in the unfortunate countries and for the unfortunate. Thank you very much.
Okay, so briefly, I think the Emirates Oncology Society mission has already started when it comes to collaboration. We have already been in collaboration with the ISMO, also with ASCO, and also with other societies in the region. I think we've done some good job so far. We've been publishing together our data. We're publishing next week, actually, the first book about cancer in the Arab world. And I think the first step is always trying to get the data right and trying to get the mindset together. And I think after this, we will move forward trying to have a bigger project between the regions and the countries.
Thank you very much.
Thank you. So any more question? Okay, to conclude, please, your comment, and then we'll conclude.
What I wanted to say that there are ways of talking to patients. So frequently I get second opinion patients because their doctors told them you have 6 months to live, or some of these sentences that we don't use or you should not be using really, because that's devastating to patients and their families. And who are we to decide if this person is going to die in 3 months or 6 months? So the way I answer it in a diplomatic fashion, I literally draw a curve for patients at the layman term, say, okay, this is 100 patients, this is 2 years, this is 3 years, this is 5 years. And I show what we call tail of the curve. So at 5 years, I mentioned 30% are alive. And invariably, the patient put their finger that I'm going to be on this tail of the curve. So first of all, you told them the same thing, that, yeah, maybe the median survival is 6 months, but it doesn't mean that you will live 6 months. And they give them hope that, yes, I want to fight, and that's with this new medication, I may end up in that 5-year camp. So this is one way I learned. Again, you don't learn that in schools or in your med school. This is something you acquire. It's really a talent. But I still see a lot of oncologists, unfortunately, they still use the term, go home, you have 3 months to live, which is devastating. So back to what you were saying, and what I use also very commonly, have patients talk to each other. There is nothing more powerful than a previous patient just finished the same treatment. I can talk and talk for 30 minutes, 1 hour. The retention rate is very low to that patient who's in front of me, who's devastated with whatever news. When they talk to other patients, just finish what they are about to start. It is so powerful, so effective.
My expectation from my doctors, and I do go for second opinion because I would like to be informed. There is a set of protocol that cannot be changed in the treatment. It's set protocol. But what's changed sometimes, use this medication over this medication because of the side effect and how you feel more comfortable. However, the problem in those things is not the various topics that you keep the patient blind about all that information. If you cannot tell him that he cannot die after 3 months, if you know and for sure, and there is possibility, then you have to inform his family in a way or another. However, what's important, don't let us turn to Google, because we are not going to be a proper doctor and we will get wrong information. So you need to inform us fully.
Like I said, we've told them the same thing in a more diplomatic way. We didn't say you're going to die in 3 or 6 months. We showed them the
actual possibility.
It's possible, exactly.
It's a possibility. You have that possibility.
Exactly,
Be prepared.
I
prefer to know so I can finish my finance before I go.
Exactly.
Thank you everybody for joining us. Thanks to the people who followed us virtually and who are with us so far since the beginning of this panel. Thanks to all the participants, Professor Shamsi, your guest, of course, Professor Peters, Dr. Wolf, Dr. Rana Haji, Mr. Ashraf Malak, and Mrs. Mary Khamasmi, 500. I'm gonna ask you to wrap up, in 30 seconds each. Let it be, maybe a hope, a promise, a pledge, a cry, whatever you want, 30 seconds each. And then we will be watching all together a report to conclude, a report that has been done, edited, and wrapped about Mary and the struggle of Mary. Mary, you've been our star today, but you deserve it, of course.
Will be in
and then once we finish everything, we need a picture all together. Okay? So please, I'll start with you. You're our host.
So our promise at Emirates Oncology Society is to continue to fight cancer and to improve the cancer care in the UAE and the region.
On my side, maybe, and that will probably be the last 2 decades of my professional life, is to try to work, and I will just start this one, on a more balanced way to deliver optimal cancer care globally. And that's why I travel today, but I travel to a nice country, but a very nice country for that. But there are many countries in which I travel, for example, next week, where there's nothing for cancer care. So that's a little piece of it, maybe we can change and start changing.
Thank you. Mary, we'll skip you because you're going to be online in a bit. Mr. Malak.
So yeah, my message is very clear here to conclude that the future is more bright and there is more hope for the cancer patients with the new innovation and the new treatment approaches that there is more hope for our cancer patients. And one thing that we can only make it happen by working all together, by joining our efforts to make sure that we will close the care gap.
Thank you, Dr. Haji.
Just again, re-emphasize, I'm a bit persistent, re-emphasize the importance of prevention and the hope in the future and the new technologies. We have technologies like mRNA with the mRNA vaccines that were actually being developed for cancer. And I think they can be even a lot cheaper than in the future, since cost is a big issue. But there's a lot of hope. We have to stay strong, and we have to care about cancer.
Thank you. Professor Wolf, we'll conclude with you. First, before giving us your pledge, your promise, or your hope, or your wish, what does it feel to be tested positive?
It was quite stunning because I've tried to be safe in my own habits. I've really been asymptomatic, and this was a positive test just before I was coming to meet with all of you. So I'm sorry I couldn't come in person to see you. What I would say is that we're in an era where we have to believe in the science and the research, increasing the data is going to help us do a better job with defeating cancer in its many forms. But we also have to remember the human side, as been discussed here in the latter part, communicating with patients, supporting patients, caring for each other in our own communities, and emphasizing the need for prevention, healthy lifestyles. It's really about caring for each other. And there's these two things that have to work together. The humanity that we all experience together with our family, our friends, our community neighbors, etc., and the incredible science that is just making for a brighter world. If we only rely on science without the humanity, we're going to fail. And we see evidence of that in many parts of the world right now, with conflict, with political upheaval. And we have to really emphasize that science and humanity are hand in hand, and we have to have respect for each other, care for one another. And I think with that, the future will be indeed brighter. And we will have a wonderful future, not just for ourselves, our children, our grandchildren, and generations to come.
Thank you so much. Today is World Cancer Day. We hope we'll get together next year and we'll have more progress, more advancement, better results, and more people healed and cured. So let's wrap up, or let's conclude with a segment that has been done, filmed with Mary. Mary, the floor is yours, or the screen is yours.
بال 2017 ما بحياتي فكرت انه راح يصيبني سرطان، بس فجأة اجا بهاي المرحلة لاحظت انه ايه السرطان يمكن واجه كثير عالم بس ما واجهني الي. قررت تابع مسيرتي مثل ما هي بقوتي. كنت انا سوق سيارتي وروح على الكيموثيرابي والبس احلى ثيابي واتزوزق وخلص الكيمو، فاتحه اللابتوب عم اشتغل وعم رد على التليفونات على شغلي، وبس خلص ضب اغراضي وارجع امشي وروح انا سوق على البيت مره ثانيه. كنت دائما صلي لربنا انه دخيلك خليني واقفه على رجلي، ما توقعني، ما فيي اوقع، لازم ضل قويه. ولما عم شوف الناس اللي حوالي حسيت انه وجعي صغير قدامهم ولازم اقوى اكثر. بمسيرتي الكانسر اكيد غير كثير، يمكن غير لي شكلي شوي، خلاني اصير بطيئه اكثر، بس ولا مره شال الضحكه عن وشي، ولا مره شال الفرحه بالحياه والنعمه. كل لحظه بحياتي كانت شهاده حياه، عشت اكثر يمكن اللحظه الحاضره، ولاحظت من وقت ما بلشت اني ما تغيرت. هي رحله، بس هي رحلتي انا بقرر كيف بدها تكون. قررت بوقتها اني اكون انا القويه وانا اللي بديرها مش السرطان، وراح اقطعها. سواء عشت او متت بالسرطان ما راح اعيش وموت غير وانا واقفه وانا عم بضحك، وانا عم بكون الشخص اللي كنت فيه كل عمري بفرحي وبرجائي، وكل لحظه بشكر ربنا على كل شيء حتى على المرض نفسه، لانه كان عن جد نعمه. وهيدا الرساله انه روحوا دائما تابعوا، ما تنطروا للاخر، لانه دائما احسن تعرفوا على بكير وتتعالجوا ابكر، تكون رحلتكم اقصر وبتضلك قويكم.
سوبر وومن. شكرا.
Testing, testing.
Hello. Good afternoon, everyone. Good afternoon, everyone. My name is Matthew Asada, and I'm serving as our Deputy Commissioner General here at the USA Pavilion. Thank you for spending February 4th, World Cancer Day, here with us, whether it's those here in the room or those that have tuned in virtually from afar. I think that Professor Wolf, as well as Ms. Kaimasmia, said it best when we're reminded about the humanity and about the people behind the science. And I can think back to Expo 2020's theme of connecting minds and creating the future. And here in the USA Pavilion, we've tried to do just that. Right next door in Exhibit 6, you'll see a piece of the moon. And at one point in time, we all thought it was impossible to go there, but we did it. And we brought back a piece of that moon, and it's in the room next door, and you can touch it. It's real. 2 days ago, US President Joe Biden announced our cancer moonshot, again, to reduce by half deaths from cancer in the next 25 years. So that cancer moonshot, may that be just as successful as our trip to the moon so many years ago. So today, thank you for joining us. And at this point in time, I want to introduce Mr. Shadi God from the Guinness World Records, who is going to do a presentation.
Thank you, Matthew. Thanks all for joining me here today. As mentioned, my name is Shadi Gad, and I'm an official Guinness World Records adjudicator. Emirates Oncology Society. Today, you attempted the Guinness World Records title for the most awareness ribbons made in 1 hour by a team. Now, I've closely inspected the attempt and I'm happy that all the rules and guidelines were adhered to, so congratulations on that. The question is this a new Guinness World Records title? Before I announce the results, I'd like to invite two people on stage. Can I please welcome Professor Hamed Al-Shamsi, Emirates Oncology Society President, and Ashraf, AVP and Managing Director of MSD GCC. Welcome. As I mentioned before, the record to beat is 1,589 ribbons, and this was achieved by Global Village on this day last year, also in celebration of World Cancer Day. Now, after reviewing the awareness ribbons, 256 awareness ribbons were deducted, and I can now reveal that after the deductions, you achieved a grand total of 2,828 ribbons. Congratulations. It gives me great pleasure to announce that the new Guinness World Records title for most awareness ribbons made in 1 hour by a team was achieved by Emirates Oncology Society on the 4th of February, 2022. Congratulations, you're officially amazing.
This should go to the team.